Welcome everybody. It's really great to see you all, and I want to welcome you to a progress report for the CHIP network, the Community Health Improvement Plan of Franklin County in the North Quabbin. I'm Jen Audley. I'm the project coordinator, and I work here at the Franklin Regional Council of Governments. And I'm going to tell you a little bit about how today's meeting is going to go. Phoebe Walker and I are going to do a little bit of welcome introduction business here, and then most of the time we're going to spend on progress reports on two CHIP priorities. The first one is going to be the child sexual abuse prevention priority, and we have Kelly Broadway and Jetta Bernier here today to talk about that with us. And then we're going to get an update on home care and caregiving, which falls sort of under our workforce shortages priority and also under our age and dementia friendly priority. And that's going to be Diane, Robie, and Yuhas from LifePath. And I want to just introduce a couple of people here who are new and who came from far away. So we have Nikki Lewis, who's here from the State Office of Rural Health. Nikki, do you want to introduce yourself and say what you do?
Absolutely. Hi, everyone. I'm really excited to be here with you all today. My name is Nikki Lewis. I started at the State Office of Rural Health last fall, so I'm our communications and outreach coordinator, and really excited to be here to listen and learn and always hear any ways that our office may be able to support the work that's happening.
And then Kelly O'Reilly is here. Kelly is a new addition to Rep. Lay's office.
Hi everyone, I'm Kelly O'Reilly. I'm a legislative aide for Rep. Lay. I am new to this position with Rep. Lay's team, but not total. I worked for Rep. Carey, the 2nd Hampshire district, for the past 6 years. I shifted over here. So, my main role in the office is going to be constituent services, so linking people with community resources, state agencies that they may need help with. We get a lot of mass health, R&D, unemployment issues. So I'm happy to talk with anybody and be a resource if we can.
You're welcome. So what I'm hoping will happen is that we will get through our presentations by about 2:15, and then there will be time at the end for you to follow up with folks who presented, to talk with Nikki and Kelly, for you to get to catch up with people that you know here and you want to talk to. So we're going to try and keep it compact today. And with that said, I'm going to bring Phoebe up to introduce the sort of the CHIP intro for this part. Yep. Do you want to also talk about the recorder and the TV station?
Our fabulous friends at GCTV are here once again to record what is happening, and Chris Larrabee from the recorder is here as usual as well. So just so you know. I went in the wrong direction. We're off to a great start. Okay, great. You know this because you are this group. So except for our new friends. So this is the group of towns and communities that we serve, and our mission, which remains unchanged and is sort of our guiding force for why we do the things that we all do and that you all do. This is a meeting of our network, and you are the network, as a reminder. If you are on the steering committee of this network, maybe raise your hand. Aha, there you have our fabulous steering committee members. Thank you so much. And we always start at the beginning with a reminder of what our model of health is. And as you raise your hand if you've already seen this one. Okay, so some of you haven't seen it, but many of you have. We spent some time as a group last year trying to come up with a model that made more sense to us. It was a little less depressing and negative than some of the other models, and a little less weirdly numerical than some other models. And this is the one we all agreed on, and essentially looks at the way that that people are born into systems that have been fed from this sort of bedrock of inequities of various systems, and this bad dirt seeps through all the resources, all the systems, all the institutions, but we can make it better. And we can make it better through people's voices in decision making, like calling Kelly O'Reilly, telling her what you think about a bill, public investments, like the legislature changing how things are funded, and advocacy, which is you getting involved in making sure that happens. And that's the way that the nice green blue water can come in and feed the physical environment, health behaviors, clinical care, and social and economic factors that then have the outcomes that pretty much everybody in this room is working on. You hopefully can see yourself somewhere in the green as somebody working on one of those things up there. You can have my seat, Gary. It's totally fine. I just put my phone there. So that's our model of health. And today's progress report is on a few of the things listed at the top of our tree of healthy outcomes. And these are the parts of our sort of healthy vision of our region that today's presentations on caregiving and child sexual abuse prevention impact. And we're going to start off with having one of our steering committee members, Jeff Nonheim, the executive director of United Way, kick us off in our discussion about the child sexual abuse prevention priority for the region. Come on up, Jeff.
All right.
This way for moving slides.
Gotcha. Do I have slides?
No, you have. Wait. You have one.
Great. Okay, thank you. All right. How is everybody? Good. It's kind of a gray afternoon, right? All right. Reducing childhood trauma was identified as a potential focus area for the 2024-2028 Community Health Improvement Plan early on, in part because of the deep impact that adverse childhood experiences, that many of you may know as ACEs, have on community health. At the same time, in 2023, several members of the Community Health Improvement Plan Steering Committee, myself included, and many of our partners participated in discussions convened by the Children's Advocacy Center of Franklin County and the North Quabbin about working together to prevent child sexual abuse. Can folks from that agency raise their hand? You're here? Yeah, it was a really good forum. Sometimes you go to forums and you leave feeling kind of depressed or blah, and that was one where I felt really energized and excited about the work afterwards, so it was good. We decided that supporting a collaborative effort to change policies and systems region-wide would be the CHIP objective for this topic. So here today to tell us about what's happened so far and what's coming next are Kelly Broadway from the Children's Advocacy Center, or CAC, as some of you probably know it, and Jetta Bernier, Executive Director of the Enough Abuse campaign, who made the trip out here today to talk with us. Kelly will begin and pass the mic to Jetta, and there's no mic, so you can just speak loudly. And we'll have time for questions for both of them at the end. Thank you.
And since I like to share stress, I'm bringing up Beth, my supervisor.
The clicker,
The clicker. Can you tell me about the clicker?
That will move to the next slide.
Oh, that's why it points that way.
Yes.
Okay. Awesome.
Hi, everyone. I'm Beth Agostino Evans, and I'm the clinical director at the Children's Advocacy Center and currently the interim executive director. This is my colleague, Kelly.
Oh, yes. Sorry, I thought you were going to introduce me. I am Kelly Broadway, and I am the coordinator of special projects at the CAC. And it just means I do a lot of things and wear many hats a lot. So, as do you.
That is for sure.
To project.
I know. So I will. I'm working on it. Okay. Thank you.
So we want to thank the CHIP Steering Committee for adding CSAP as one of the priorities for the 2024 to 2028 goals and objectives. The addition of this priority as a CHIP goal is a recognition that child sexual abuse is occurring both in homes and in the communities that we live and work in. For people that are doing the front-facing work of child safety and protection, we either provide or receive the reports about the abuse that is happening, who is being impacted, who is causing harm, where it's happening, and often the results of the investigation. For those not in this field, there are sometimes events that get press coverage, and people ask, how did this happen? Why is this happening? Why did we not see this? Most child sexual abuse occurs in relationship. It is estimated that 91% of child sexual abuse allegations are against someone the child knows. And that's because it is both a challenging topic to talk about, with many thoughts and feelings and values that come into play. And not talking about, especially to kids, is doing a disservice. In general, people who want to harm children put themselves in positions where they have access to children. Hence the need for a regional prevention strategy that holds all of us accountable for the safety and well-being of children. You want to do the clicker? Click away.
Yes.
Okay. So I'm going to tell you a little bit about the CAC and our role in supporting youth and families in our community. The CAC is a nonprofit organization. We are not part of the district attorney's office, though of course they, along with other law enforcement entities and DCF, are critical partners in responding appropriately to allegations of child sexual abuse, including exploitation and trafficking. Our CAC opened its doors in Greenfield in early 2016. Since then, we have supported more than 900 children and families impacted by child sexual abuse in the Franklin County and North Quabbin area. We support an average of 100 to 150 child victims and non-offending caregivers per year. We host forensic interviews for child sexual abuse investigations, as well as medical forensic exams with a pediatric sexual assault nurse examiner. We also provide victim and survivor advocacy, resource and referral, court accompaniment, as well as several evidence-based therapies for child and teen victims of sexual abuse.
Have any of you been to the CAC? Okay, so if you haven't, we love giving tours. And this is a lovely labyrinth in the back of the building, and kids love to run around there. So it is great to have. I should do the thing. Okay. So in 2024, we ran our next strategic planning session for 24 to 26, and we added child sexual abuse prevention implementation in the region as one of our goals, and it will stay as part of a strategic goal as we continue forward. Prior to that, a critical event had happened, which did not get a lot of press exposure, but was very impactful. And a group of people were pulled together, several people from the FERCOG, as well as Enough Abuse, Jetta from Enough Abuse. And we wanted to have a equitable response. And so we held an event. It included some training, some prevention, lots of handouts, some discussion. And it was good. But we discovered that it can never be like a one and done. And so we said, now what? And so we said, we need to look at what the prevention strategies are available. So we kind of paused and we did some research. And then it turns out that the Massachusetts Legislative Task Force on the Prevention of Child Sexual Abuse, which was created in 2015, did a whole bunch of work in researching best practice prevention elements and created a product that is called Safe Kids Thrive. And we adopted that model as the one that we would like to use or offer in the community. And it is the beautiful thing about it, it's just a framework of 8 prevention elements that is flexible and available to youth serving organizations, and they can take and use what they want, which also means it is not prohibitive or doesn't exclude any other prevention elements or programs or strategies. It's very inclusive, which is why we love having Jetta here today as well. So that's That's how we got into this, because we see it every day, and it breaks my heart, and I need to do prevention work to continue to be in this field. So I think I already just said all of that. Yeah.
Yep.
That's our therapy room. So these are the prevention elements that are offered by the Safe Kids Thrive framework that we will be providing technical and training and technical assistance, consultation, and guidance to youth-serving organizations about how to use it. It is available and free online. So much good stuff on the website, but who has the time to and what do we need to use today? So we're going to be the liaison between what is available and providing it and guiding by request people that want to use the framework to implement better strategies for prevention. So we have policies and procedures. I'm just going to read them quick, and then I'll give you some examples. Code of conduct, monitoring, recognizing, responding, and reporting, safe physical environments and safe technology, screening and hiring, training, and we have to have sustainability or it's not going to be effective in the long term. So for example, when you're looking at policies and procedures, how often are they updated? Does everyone get to provide input on those? Are they provided to the parents of the youth that are using that site or that organization? Do you have an appropriate code of conduct that tells the staff that work there what is and isn't okay very clearly? And do you provide that code of conduct to the parents and the kids so everyone knows what is and isn't okay? Recognizing and responding, mandated reporter trainings, how often are you doing them? Are you providing a safe culture where you can call out if you see something happening that shouldn't be happening, and that's just okay because that's what keeps kids safe? Screening and hiring. What practices and background checks are you following? Are you doing the bare minimum based on your funding source and what they require? Or are you doing a little bit of extra work? For example, if you're running fingerprints, I don't know if people know this, but providing information to the FBI by law enforcement agencies is voluntary. And about only 18,000 law enforcement agencies, schools, and university campuses are providing information. So if you're running a background check using a fingerprint, it's not going to catch something that might have happened somewhere else that isn't providing that information. So how are you going to find that? What else was I going to say about that? I will, I'm almost done, but Natalie Blay, our representative, has submitted another bill this year on March 12th for increased screening for people that work in schools that would mandate employers to request a statement from previous employers when they're hiring a candidate that there's been no allegations, charges, misconduct, put on paid leave or administrative leave, or asked to resign because of inappropriate relationships, contact, boundary violations with students. And that would be amazing. But right now we can't ask those questions to references. But what we can do, and I just learned this, is if we're hiring someone, we can have them sign off on a thing that says, none of those things have happened in my employment career. So they have to make a choice in that moment of well, I did that. Or they could say I better just tap out of this. I don't want this job, because it's gonna it's another barrier that they have to be faced with if they're intending harm, and they're not looking for barriers. Does that make sense? Mm-hmm. Okay, so there's just some very clear examples of how you can improve and increase your prevention strategies. And the way we are going to do it, and it might evolve depending on what's needed, a whole bunch of community education through existing provider networks. There are so many provider networks and meetings. Happy to join them and talk about keeping Safe Kids Thrive and keeping kids safe. I am a trainer for the Keeping Kids Safe parent curriculum, which is free. I can go to organizations and talk about the prevention elements, and if one organization wants to use one of them, that's awesome. It's one thing that they're doing better than they were doing before. And if they want to integrate all of the elements, that's even better. And that will be done through learning cohorts, hopefully starting this summer, where we will take similar youth-serving organizations, perhaps coaches or after-school programs, and just a handful of them, and like one by one we'll go through all of the policy or the prevention elements, and they can assess where they are and what they need to improve. And one of the things we're looking to do is, by the end of all of this, though we will keep going, is what are the barriers that youth-serving organizations and schools are facing in trying to increase their prevention? So do they need cameras for spaces that are not like sightline clear? Do they need money to train staff? Do they need staff time to do better screening practices? So we're going to be collecting all of that information, and ideally, we'll go to Natalie Blay and say, it's not just schools. Here's some, we need better policies that from the state that can support best practice prevention. So that's just real.
Great.
Yes.
Thank you so much.
Yeah.
Really exciting to see you guys moving into this arena. Thank you so much. Did I go in the wrong direction? No, I didn't. That's how to get a hold of Beth and Kelly. And you will, as usual, get an email after this with the slides and the links and Bella's video and Chris's article. So you'll be able to find everybody who's here. And now we'll turn it over to Jetta to let us know what she's been up to in Franklin County, North Quabbin.
Yes, thank you very much.
You're very welcome. Do you want your slides here?
I just have a few things here.
You have yours?
Yeah,
okay.
that's
Do you want
great.
me to click, or are you going to click? That's the right one.
I
Okay.
can do that.
Okay.
Well, it's so good to be here today. I want to thank you, Phoebe, for the good support that you've been sharing with us for the past year or more. Kat, I don't know, is Kat here today? I didn't see her.
She's at the State House.
She's at the State House today. And of course, my new colleagues, Beth and our friends, Kelly from the CAC. We are going to be working very closely together in the months ahead to see if we can really deliver real solid child sexual abuse prevention efforts here in Franklin County. So I just wanted to take maybe just a quick moment, because you're probably wondering, who is this organization and all of that? Let me just give you a quick summary. The Massachusetts Committee for Children and Youth was started in 1959. We began to refer to ourselves as Massachusetts Citizens for Children, and more recently as Mass Kids. It seemed like a quick way for people to understand who we were. But in that period of time, we've always been committed to preventing child abuse, child maltreatment in all of its forms. We were very much involved in the state in the issue of preventing shaken baby syndrome, now referred to as abusive head trauma. And we've been involved in many, many aspects of child advocacy. But the issue of sexual abuse has always been quite important to us. In the mid-'80s, we began working on that issue here in Massachusetts. We developed a statewide media campaign, the first in the country, that basically said to people, teach your kids about child sexual abuse before somebody else tries to. We went on to do a number of things with Marvel Comics. We developed the Spider-Man comic, a special edition in which he was identified as a victim of babysitter sexual abuse. So we've had a role to play for a long, long time, but it wasn't until 2002 when the CDC decided it would try to involve adults and communities in preventing child sexual abuse, because at that time, most of the efforts were directed at teaching little kids about good touch, bad touch, red flag, green flag, and they said, where are the adults in this equation? So they issued an RFP, and we were grateful to be one of 3 states that received funding, $1.2 million over 5 years, actually. And so that gave us an incredible opportunity to really understand the issue, to figure out what was happening in the country, around the world. So we were able to really have that great opportunity to get in the weeds. And of course, after doing that for 5 years, we learned a lot. And so we began to do, work in the community, educating parents, working with all of that. But I think one thing more recently really grabbed our attention, and that was in 2004, the U.S. Department of Education commissioned a report to try to understand what was happening in schools in particular. And based on this report, it was estimated that 4.5 million children in public schools are engaged in some kind of inappropriate sexual contact with an adult in their school. That turns out to be essentially 1 in 10 children. So that was a statistic we couldn't live with. So we said we've got to focus on schools because that's where children live and learn and play the most of the time. And we began to do all of that. But then about 2 years ago, a new study was developed by Jeglick, a researcher, who interviewed many recently graduated high school students and was able to understand that things are getting worse. 12% instead of 10%, which essentially means 1.85 children are now reporting some kind of inappropriate sexual contact. Now, I want to be clear that this is not rape. We're not talking about all of these children being raped, but in fact, we're now beginning to get more into the weeds in terms of what are the inappropriate behaviors. And we're seeing, verbally inappropriate comments, sharing of, materials through internet and through texting and all of that. But again, and of course, there are too many cases in which there really is a sexual relationship that's been developed. So I think because of that, we've kind of shifted our energy to this issue of schools. And so we're excited that the folks at the CAC will be focusing on the youth-serving organizations. That's critical. We think that our best expertise at the moment is to focus on the schools. Not that there's a clear demarcation line. We'll be coordinating and sharing information back and forth. Because the same things that are needed in schools are also needed in youth-serving organizations, and you eloquently described what those are. Doing an assessment. What do your current policies look like? Making sure that there is a neutral review of all the policies to see what are the strengths and where are the missing pieces. So anyway, with that in mind, when we began to work, you reminded me that it was, I think it was June 1st of 2000, and what was it, 22 maybe? 23. We worked with Jeff Trant and the district attorney, Dave Sullivan, and we put on an event that, it opened the door to the notion that Franklin County really wanted to take a full steam ahead approach on this issue. Anyway, so I just wanted to give you a sense that one of our focuses, obviously, is to prevent school employees from getting involved in sexual misconduct and abuse. So we have 3 schools that we're working with here in this county, and these are schools that are all very, very familiar to you. We've identified, when you say Greenfield, it's not just one school, obviously. We're talking about 5 schools, 6 schools, 3 other schools. So we're hoping to have an impact on all of these employees over the course of our time here, and we hope that will translate in some important changes for all of those students that you see listed there. One of the ways that we are moving forward is we're offering to all these schools our 1-hour online course. We call it the Enough course. Enough preventing child sexual abuse in my school. And we also have an in-person curricula that is available to be used specifically for schools. Greenfield has participated in this training. Mohawk Valley has now begun to roll out the course, if you will. A number of the key administrators and other staff have now taken the course, but it will be rolled out to all of the schools throughout the Mohawk Valley system. We also have a number of tools. Understanding and responding to sexual behaviors of children is a curriculum we've had for a very long time, but the real focus of it is to identify children with problematic sexual behaviors. PSB, it's got its own alphabet now. We're understanding that in maybe over 50%, maybe even higher, of cases where children describe having been exploited or abused, the child, there's a child who harmed them. There's a child that's been harmed, a child who did the harming. We don't really want to call this child a child who is abusing another child. I think we need to be really, really careful about not labeling kids. There's so much hope for these children if they have an opportunity to get the help, and I know you know that firsthand. Anyway, so we have this curriculum. It's an in-person curriculum specifically focused on schools, and we're hoping that we will have an opportunity to do that training, here in Franklin County. It's Not Just Jenna is a wonderful 30-minute video that we produced several years ago, and we initially developed it for parents and for, people in the community. A lot of faith-based groups liked it. But we had a school in Waltham that said, no, we think it would be great for our junior and senior high school students. And all of a sudden now, they love it. They're able to watch this video and then to talk about what can I do if it happens to me? Or how can I be a good bystander if it happens to someone that I know in my school? Anyway, let's go on. There's so much to say. It's, as I said to my colleagues here, the worst part is, how to say so much in so little time. But we will be back for sure. Anyway, let me go through this quickly. Yes.
Can you do it in about 3 minutes?
Yeah. So basically, I've already described some of this. We've got a school 60 question assessment tool that we're sharing right now with the schools. I've reviewed many policies, identified the strengths where there's some need for improvement. We have a number of other resources. We have a self-assessment tool. We have one for coaches. Are you crossing the line with a student athlete? A number of questions that help them reflect on their own behavior. And am I on this slippery slope that's going to get me into trouble? 25 boundary violating behaviors. That's a flyer that we give out extensively. Straight talk guides. There's a number of them over there, as you'll see on the table. And student safety posters. I brought a few of them here as well for you to take a look at. I'm excited to report that the Greenfield Recorder, and thank you very much over there, Chris, for helping open the doors there with the managing editor. They will begin publishing, I think today, tomorrow, sometime very soon. Saturday.
I think it's going to run alongside this story on Saturday.
Oh, terrific. Okay. So we developed 20 tips for parents, and the Greenfield Recorder has agreed that they will publish one tip a week, one tip a day over the course of 5 days, over the course of 4 weeks. So the 20 tips will be rolled out, and we're hoping that will, really be an inexpensive way for people to just learn, what can I do? How do I talk to my children? We're distributing the Straight Talk booklets to schools, and the Choose Your Partner Safely. I brought some of them here today. We have distributed those to the Department of Children and Families because they deal with a lot of families where there are single-parent families, and the issue is you must choose your partner safely so that your children will be safe. Anyway, that's all there. This is the billboard that I saw just about an hour ago as I was driving into town. We thank you and FERCOG for helping support that. This
State Office of Rural Health for paying for it.
Yes, okay. So this billboard will be up. We expect about 200,000 impressions over the course of the month. And then we also, because the county is so large, we have actually some geofencing ads that are going to appear throughout the county. There'll be about 90,000 impressions. These will be on people's mobile phones. They'll be getting these pop-ups. So that's another way. And of course, we were grateful to be able to have FERCOG and the Children's Advocacy Center that have added their logos. So, to show the community this is a really well-supported initiative. The last thing I want to do quickly, and we can maybe hold a lot of this for questions perhaps, but we are very much involved in pushing for a package of child sexual abuse prevention bills. We've been at the forefront of this since the 2015-16 legislative session. And, we're grateful for Representative Blay. She's been with us all those years. These are just a quick summary of the bills that we're currently working on. The Representative Blay, when you see strengthening screening of new hires, that's her bill. We've had a lot of support from Dave Sullivan in terms of closing the age of consent loophole. Again, we could do an entire program just about this. And also we want to thank, you notice the one on the bottom, criminalize the production, possession, of distribution of child sexual abuse materials. This used to be the term for child pornography. Now we refer to it as CSAM. Senator Mark worked with our office. We looked at language all around the country, came up with the best language on how to identify behaviors that need to be criminalized with the use of AI and technology and all of that stuff. We're also working with Senator Comerford. She's in the process of working with us, and there may be an additional bill that will be introduced to deal with a lot of these things. Anyway, I should stop there. Would love to get... I will stay a little bit after if you'd like, and I'd be happy to answer any questions. And any of you interested in legislative issues, there is a document there, but you can always reach us at enoughAbuse.org, and we would be happy to share with you all that we have electronically. Thank you.
Thank you so much.
Thank you, Jetta and Beth and Kelly. And I want to point out that at the Family Center, the Community Action Pioneer Valley Family Center, there's going to be a session of keeping kids safe. Kia Burton King is here. Kia, do you want to talk a little bit about when and how that's happening?
Sure.
While I forward the slides.
It starts, we're running the program next week, but we also will be running it in Spanish for bilingual caregivers in the month of May. We just had, we're a Mass Family Center and a Massachusetts Family Resource Center, so we just have both teams trained to be able to deliver that content more often. And in multiple ways. So right now, next week is in person, in English, and then we will follow up in Spanish, and then we'll look to virtual offerings. But we'd really like to have it in person just because of the nature of the content, and we have clinicians on site, and just more supports. Childcare is offered, food, transportation supports for families in Franklin County. We can make it happen at Bridge if you have a family that's in North Quabbin or outside of Franklin County.
And I will just tag team in that VOC is also hosting the Keeping Kids Safe on May 7th.
Yeah.
Fantastic. That's great. Heather.
I just wanted to add in, I'm Heather by work again from the North Quabbin Community Coalition, and we worked with Jetta and Mass Kids for years and years. So this has existed in North Quabbin for quite some time, and we're just so excited that it is spreading, being more available. Valley Our Children has several trainers, as well as myself, in the Enough Abuse campaign stuff. So anything that we can do to spread the word from North Quabbin over, we want to make sure that that's part of this as well.
Fantastic. Thank you for coming today, Heather. I didn't get to say hi to you when you came in. So this is terrific. I didn't realize that it was going to be Child Abuse Prevention Month when we scheduled this update for today, but I feel like it's really appropriate, and it's really exciting to see all of these things coming together and beginning just in this very first year of this 5-year push that we're doing to try to make child abuse prevention be a region-wide effort and to really change policies and systems. So I feel good about the direction that we're going. And we'll try to make sure that there's time at the end for you to check in with folks if they can stay. I know that Jetta is actually heading off to one of our school districts and needs to leave promptly at 2:30, but I'll make sure that her contact information is in the slides if you want to follow up with her. So now I'm going to shift us over to the other topic that we're getting a progress report on today. It's broadly under the CHIP priority of workforce shortages, where we had said that we wanted to work on making sure that critical healthcare roles were getting marketed and filled, that people knew about these jobs that people could do that we really need more people to do in our area. And there's 3 categories of jobs that we identified for this 5-year cycle. One was home health aides, one is nurses, and the third one is early childhood educators. And we thought we would focus on the home health aid category first. And then a few things happened. We started talking with our partners in the workforce development world. Those are our partners at GCC and workforce development, and our partners at Mass Hire, the Workforce Development Board, and the Career Center, and learning about kind of what challenges they're seeing, what opportunities they're seeing. And there's some really cool stuff happening, and I do want to let you know that Alex Carley from GCC let me know that they are planning to offer a tuition-free CNA, that is Certified Nursing Assistant / home health aide training program in July. So they're inviting job seekers throughout the community to apply, and they are also inviting healthcare employers to consider enrolling incumbent workers, such as dietary aides or environmental service workers, to upskill into those roles within their organizations. The website has pre-registration and inquiry forms for all of their programs, so you can add your name to the waitlist now for that tuition-free course in July. The website is train.gcc.mass.edu, and I'll add that to the slides because this information just came to me. But for today, what I decided that I wanted to do was to actually back us up a little bit and take a bigger picture view. of what is home care, what is care that happens at home, and what is caregiving. And I wanted to include both paid caregiving, like home health aides and homemakers and certified nursing assistants who might work in the home, and also unpaid home care, unpaid caregiving, volunteer caregiving, family caregiving. And that's partly because part of our legislative agenda carried over from the last session is this bill that is sponsored by Senator Comerford and supported by all of our legislative delegation that asks for a change in the law to allow spouses to be paid as caregivers the same as other family members are. And that legislation is part of a new bill that has been introduced in this session that's called the Family Caregiving Act. And so I wanted us to learn a little bit about that act, and I also wanted us to learn more from LifePath about what they do to connect people who are caregivers with paid help, to help people connect with these kinds of roles, and for us mostly also to understand, like, what is the funding landscape for this? Who pays for these services? And how are we what are our options for being able to adapt and change in a changing landscape of funding, both on the state level and also on the federal level? So the best people to present on that, for sure, were Diane, Robie, and Gary Yuhas from LifePath, and I have asked them to come here and tell us all about it today.
Thank you. We appreciate being here. The news is good and not so good. So, which I'm sure is the case for many of you in this landscape right now. I am Diane Robie. I'm the Director of Client Services, and with me is Gary Yuhas, the Executive Director. Many of you know, next slide, Gary. Many of you know LifePath. We are celebrating our 50th anniversary. We touch about 10,000 people every year, thank you, and about 4,500 receive ongoing services. Here you see a picture of a young man in our adult family care program. He actually makes and sells these hats at local markets. Oftentimes people think about LifePath as serving elders. We actually serve people as young as 4 up to 104 and beyond. And we're dedicated to the well-being of older adults, people with disabilities, and caregivers. So we want to talk a couple of minutes about the unpaid caregivers, oftentimes the unseen caregivers. So in Massachusetts, there are 780,000 caregivers providing 730 million hours of uncompensated time. That adds up to $15.1 billion. This is in Massachusetts alone. The average caregiver is about 49 years old. They provide about 24 hours of care a week. Some of them are providing 40 hours or more. People in a caregiving role, informal caregiver role, often fill that for about 4.5 years, with about 30% doing that for 5 or more years. Now, we know that this is low because many people don't identify themselves as caregivers. So the next slide, Gary. So oftentimes when we think about caregivers, we think about those things on the further side. Bathing, dressing, toileting, those are activities of daily living, but many people are providing these other activities that are necessary for people to be able to live independently in their communities. So if you look at this list, how many of you are providing one or more of these services for somebody who has a disability or is an older adult? How many of you are providing 3 or more? Okay, some of you are, so kind of, right? So there may be, for some people who are providing some of these services, opportunities for them to get compensated for that. And that's part of the message that we want to get out there. It's also an opportunity for people who may not think about coming into the field being able to do this. So again, you may have somebody who's recently graduated from high school, or someone who's in college, or perhaps a retired person who may be able to do some of those skills on this side of the graph up here and find a way to be able to help strengthen our community services, home and based community services. So next slide, Gary. And why is it important? It's important because of the stress that caregivers experience every day. So about 40% of caregivers report symptoms of depression or anxiety, and that's even higher for people who are caring for individuals with dementia. 30% or 23% are more likely to develop a chronic disease than others in their age group. 60% report sleeping difficulties. Again, there's a lot of family stress. Many people say that they're not getting support from other family members, and this also impacts ongoing relationships. We know that women are disproportionately higher caregivers than men. But when I look at this photo of one of the participants in our community engagement center dropping off his wife and saying goodbye for the day, it just warms my heart and tells us why people do this. So some of the supports for family caregivers, the Community Engagement Center, which was a grant-funded program through a respite innovation grant, provides respite care for about 25 individuals who can come to the center 2 days a week, where they're provided with engaging programming and socialization, and these are primarily people with dementia. This program will sunset in June unless we're able to find continued funding for this program. The Family Caregiver Support Program offered through LifePath receives federal funding. Again, we're all a little bit nervous about what's going to happen with federal funding, but this provides a staff person who can go out and meet with individuals, let them know what options are available for them and for their loved one, and help them navigate the system. It also provides access to respite care, some financial support for things like equipment, and other caregiving expenses. The average unpaid caregiver spends about $7,500 a year on items for care. We also have a variety of support groups in dementia support. Many of these are funded through grants at this point. Next slide, please. So take a moment and read this slide, and I will read it. So caregiving is all-encompassing. It doesn't stop just because you're tired, overworked, frustrated, out of time, or overwhelmed. This program, and this program was the CEC, is teaching me that I'm worthy of help. I'm not alone. I'm not invisible. And so that's what we want to highlight, is that caregivers are doing this work. They feel alone, they feel invisible, and we want to elevate the support that we're able to provide to them. So one of the ways that that's happening is through the act that Jen mentioned.
Thanks, Diane. So this is the Act Supporting Family Caregivers. The bill number is there. You can easily find it on the internet if you wanted to dig a little bit deeper. It's an evolution of previously introduced legislation from Senator Joe Comerford. I don't think there's any staffers. No. I want to send a shout out for people who are not here. We are so lucky to have the representatives we have, because they truly get what we do, how we do it, and want to help us do it better. So the Act Supporting Family Caregivers, I was going to sort of go through some of the points. Some of them are listed here, and I'll expand on those a little bit. The Act endeavors to set up a committee that involves people actually doing caregiving work to be guides for Health and Human Services and other state agencies in the work. It endeavors to provide respite vouchers up to a certain income limit. The income limit is $135,000 for singles or $250,000 for a dual. So it's not going to exclude a lot of people if we can get it moved forward. Expands to eligible family members. And I think it's really important to consider or to remember that a component of this is the person receiving care in the proposed legislation can be 18 and up. People often think of caregiving and they think of older adults only, but this is really for anyone who has reached adult status through the end of their life. Offers up refundable tax credit. One of the interesting components of that is offers up the ability for a break on state taxes if you need to make modifications to your home to allow for someone to remain in the home, and provides additional assistance around insurance and prescriptions, including some emergency prescription care. So those are some of the pull-outs that we thought were really important. I also have bullet points from Elena in Senator Comerford's office. I wanted to sort of go through those really quickly and highlight what they, being Senator Comerford's office, share as their short summary. Family caregivers provide care and support for a relative with a physical or mental health problem, allowing their loved one to receive dignified care and remain in their home. While providing essential services, the caregivers often experience hardships that include a loss of income. If they have to leave their job, they experience workplace discrimination and their own mental and physical health challenges. The bill creates new benefits and policies to support these individuals, including the ones that are listed there. Another one that's not listed is expanding unemployment insurance eligibility for people who have to leave their jobs to care for a relative. So that would provide a little bit of a bridge. Protecting from workforce discrimination, creating the advisory council, and the expanded drug coverage that I mentioned. And I just wanted to sort of reiterate those. And even though Diane touched on them, I wanted to sort of put out there what is the legislature's sort of angle in this before we move into what they're actually hoping to accomplish. And some other really important points are around 50% of the family caregivers, as Diane mentioned, have to use their own money, average about $7,500 a year. The $15.1 billion is money that is being saved, and the people that are saving that money are taxpayers and the state government, oftentimes also for-profit institutions. So people are taking care of folks in their home who may otherwise be somewhere else. And, as Diane had mentioned, people are juggling and people are feeling stress. Nearly 2 in 10 had to quit their jobs, and more than 4 in 10 had to switch to part-time work. So imagine having to do that in the context of inflationary pressures and all the other things going on. And it's incredibly challenging to be in the role of a family caregiver. And we have a leave behind that has some other information, so people will have access to that. And with that, very brief description that does not adequately cover the legislation, I'm going to turn it back to Diane.
So I want to move into looking at more formalized caregiving. And I have 5 minutes, so you'll see that there are links here. So I'm going to move really quickly, but know that you can get more information. So folks can become involved in providing care for people in our community through volunteer work. We have volunteer programs at LifePath and through villages. There are 6 villages and 2 in the works in which it's a kind of neighbor-to-neighbor program. LifePath also started a neighbor-to-neighbor program when our wait list was at about 250 people who were waiting for services. We said, we know that there are those people who are doing the things on the list. Can we bring them in and pay them to be able to help do that, not only for the person that they're helping, but for others? So that's over there. There are home care vendor services, and we'll talk a little bit about that. The personal care attendant program, PCA, which again is a person-centered driven program in which you get to hire the people who you want to take care of you. So that could be friends, neighbors, and we hope at some point spouse. And the adult family care program is where an individual lives in a home-like setting, oftentimes cared by family members. And that person receives a stipend, a tax-free stipend for being able to care for the individual. So again, there's opportunities for us to support some of the people who are out there doing this work. We just need to spread that news. Okay. So just quickly, these are the people who provide care. You don't need to know the titles. You just need to know that there's a lot of people out there who do that, and there's a pathway to move through a development process to be able to increase wages. Again, we know that, next one, Gary, we know that, again, many people are coming into these entry-level jobs at $15 an hour, and that's not enough to be able to support yourself and your family. So we want to make sure that those pathways are there. A couple of things just to note here, if folks are looking for PCAs or want to be PCAs, there's a link there to be able to get connected. Jen mentioned Greenfield Community College. They are also partnering with LifePath and looking at bringing more LPNs in, and we've had some students both from GCC and from the technical school come and volunteer in the Community Engagement Center. So again, great opportunities and partnerships there. Now the troubling news. Our home care program currently serves about 1,250 older adults. As I mentioned, there was a wait list. That wait list is now dead. The wait list is not for people to come into the program. They are in the home care program, but they're waiting for a vendor service. So they're waiting for somebody to come do their laundry or to come do personal care. That wait list, I'm happy to say, is under 100 now after being up to 250, so that's great. The bad news is that the state has put caps on our services and the amount of money that can be put into an individual's plan. Not only are there caps, but for us that means cuts. So we need to reduce the number of people who are receiving an enhanced level of care down from about 150 to 91, and that number could go down. What that means is an example that I heard just yesterday was an individual who's in her mid-60s. She has a number of chronic health issues, some mental health issues. Her son is her caregiver, the only person that she has who can provide assistance to her. She recently returned home from the hospital, needed some additional care. One of the things that she needs is bathing. He's uncomfortable bathing her. She's uncomfortable having him bathe her. So we were able to find a home health aide to go in to provide assistance there. She also received a PERS, one of the buttons that you can push if you fall down, that gave him some reassurance, and some foot care by nurses. Now, if she were looking for those services today, we would not be able to provide those services because she would be at a level of care that is capped, and she would be on a wait list, and it would be at least August before she could get those services. In the meantime, you can imagine what would happen to him and what would happen to her and the cost that that would be to all of us. our personal care attendant program. We used to be able to bring folks in within a couple of weeks because of the nursing shortage and the inability to get out and do assessments. People are now waiting anywhere from 3 to 6 months before they can even be determined that they're eligible for the program and be enrolled. The good news is that our adult family care program is able to bring people on who are caring for someone in their home. The challenge is that if we do not have a match where two people are already connected, we don't have caregivers. So when we're looking for people to discharge from nursing homes or from the hospitals and they need some additional support, they don't have a home of their own, AFC would be a great place for them if only we had the ability to have caregivers in that program. So I was asked just how can you access these programs? Just call LifePath. There are too many ins and outs about each one of these programs for us to go into. So just call us and we'll help you figure out how to enroll in one of our programs. Back to you.
All right. Thank you. So I think we're tight on time. Who's my timekeeper?
You're doing okay, Gary.
Oh, there. You're over there.
You know, 2 more minutes.
Okay, thanks. Okay, 2 minutes. Lot to say. So advocacy at the state level, we at LifePath really encourage people to work through mass aging access. That's our network and trade association. We are one of 24 ASAPs across the state, Aging Service Access Point. All 24 of us are members. And I talk to our representatives and their staffers frequently, and consistent feedback I get is they love this methodology because if you call in and you leave a voicemail, they will take the voicemail, they will make a transcript of that, and they will utilize that for their work. If you utilize this mechanism, you can type out your own email so they don't lose nuance. You can share your own story. You can get others to share their stories. And it's really impactful when Joe Comerford can go and say, oh, we got 700, actually we have one of the initiatives got 1,500. We have 1,500 responses to a mass aging access advocacy ask. So it distills and concentrates our advocacy efforts under one framework, as opposed to, well, we got 3 from LifePath and 2 from Berkshire's and 5 from wherever. So we really focus on that, and we'll show you what that looks like here in the next couple of slides. The ACT supporting caregivers, please reach out to your representatives. That is a state act, so this is your state reps reach out to. Advocacy at the federal level, I don't even know what to say about this. Like, who right now is doing a great, like, who thinks everything is great? And 0 hands. In talking with Kobe Gardner-Levine from Jim McGovern's office this week, they hear you, they know the problems, they're happy to take your phone call, they're happy to take your email. It is what it is right now. They are really stuck on what they can actually do. It's not for lack of trying, but if you look at the landscape, if you pay attention to the news, they're in a hard spot. People are literally walking out of their office in tears because people are calling, screaming at them. They're receiving threats. It is just terrible. It's a bad, bad scene. So going back to, please advocate via email when at all possible. And so if you would go to that Mass Aging Access website, this is what you would see. Up there in that top right corner, there's a Take Action button with the yellow arrow. I meant to put another slide in here, and I did not do that. So if you click the orange button, what you would see are the network's priorities. So you're going to see what we, as an Aging Service Access Point, are focused on. And that's really around additional home care funding because of the various cuts that Diane had mentioned. And one of the biggest ones is Medicaid. So if Medicaid is cut, even at the lowest level of $880 billion, it is going to have a catastrophic effect on our state. And the latest buzz out of Washington from folks who were there lobbying, including some of our team members this week, is the $880 billion might be turning into $1.3 trillion. So that will actually decimate economies. Hospitals will close. States will lose funding. It will be a horrific situation. So I encourage folks to go there. pick and choose what is important to you and what is important to those you care about and those you love and those you care for, and do what you wish. We have to be very careful about what we tell people to do as a nonprofit, so, just putting that out there. And then right now, just sort of to wrap up, it's a challenging time. We are focusing on our mission at LifePath. If any of you are on the LifePath email mailing list, you would have received an article that gets published in the Recorder on 4/5. Thank you to the Recorder. It's an article called The Good Life. I wrote this one. I don't write all of them. It is not a feel-good article. So if you don't get it in your email and want it, you can reach out to me, or you can just read it in the Recorder on the 5th. It highlights at a very high level what the current state and federal funding challenges are going to look like for us as an agency, and how we're going to have to make difficult choices as other people are also making difficult choices. So we're trying to stay grounded in positivity. Diane is one of the folks who really keeps us focused on that. We try to end our meetings with shout outs and gratitude. So try to remind people that the work they're doing is valuable, meaningful, and has positivity attached to it. We are focusing on resiliency, reliability, and relationships. Relationships is the only way any of us are going to survive this. We are so rich in relationships in this community, and we really need to lean on those. And we are built upon partnerships, and that's going to be key for us. So that is where I would end. I don't know if we're taking questions or I can push the button. Yes. So I will look for guidance from what we're doing next.
So I'm going to hand it over to Phoebe to talk about these advocacy trainings that we're sponsoring in the next couple weeks.
So quick. Please come. Everything we've just talked about basically involves either state money or a law. And you can help get comfortable. I think we're at really different places for all of us about our comfort level with trying to make a change in the state budget and the state laws. And I guess I just want to name, it's a rough year. We're not going to get a lot of what we want, but that doesn't mean we don't try to build this muscle. And even if we don't get a lot of money for things, we might change the laws. And that is worth doing. And we're at the beginning of a legislative session. So now is the time to sort of educate yourself about how that works. And these are, they're each 1 hour or so. They're online. They're going to be recorded. If you sign up and you can't come that day, you'll still get the recording. And it leads you very carefully through how does the state budget work? How does the legislature work? And what is educating? What is advocacy? What is lobbying? What can you do at home from your email address? What can you do at work? Newsflash, more than you think. Except you. So please do come. Andrea Freeman's a great trainer and knows a lot about this, has had years of lobbying and educating and advocating. You'll get the link, and you can also see the little bit.ly thing right there.
Yeah, and then
Yes.
push the button.
I will push the button. People, we're very grateful to have you all here, and thank you very much for coming. And does anybody have no, you want us to just stop and we can talk amongst ourselves?
If folks have questions
Yes.
that they want to ask in front of the group, now is the time.
Major questions? Okay. Please mingle with your colleagues. And thank you for coming. And we'll be back at this again in October 23rd.
We will probably do
Yes.
something super
We're going
fun
to do
and
something
different
fun in the summer that's just outdoors and is being together. Yes.
Thank you all.
Thank you very much.